Hello, everybody. My name is Jed O'Connor, and today we are going to be talking about preventing falls with safe medication use. Before we begin, if you have any questions, please leave them in the comments section, and we'll address them in the presentation at the end. And if we aren't able to, we will get back to you via comments. Today I have with me Amanda Lynn from the Washington Poison Center. Amanda, would you please tell us about your role at the Washington Poison Center?
Yeah, thank you so much, Jared, and thanks for having me. My role at the Poison Center is I am a pharmacist by training and have had special advanced training in toxicology where I am able to answer the phone from folks in the community as well as in our healthcare facilities here in Washington State. My additional training certifies me as a specialist in poison information, and so that's what I do here at the Poison Center.
Awesome. So fall prevention seems to be a topic that's kind of outside the Poison Center's typical umbrella. Can you set the stage for our discussion today and tell us why we at the Washington Poison Center are talking about falls?
Yeah, so falling is not a normal part of aging, and they are preventable. And most falls can be caused by a combination of factors. One of the main factors includes medications, their side effects, as well as medication errors. And where the Poison Center comes in is that many of those factors we have specialized knowledge about that helps us to answer questions as well as strategize with people how to prevent errors, how to safely use their medication, and be able to take steps to, prevent that as one of the main causes of contributing to falls. Some examples that we get from callers, we get calls every day. And I have to tell you, most people, when they are calling, start off saying something like, "Oh, I can't believe I did this. This is so silly." And I always tell them it's not silly at all. We get calls every day from people who maybe they took their own medicine twice. Maybe they took their husband's medicine instead of their own medicine. Maybe they took their child's medicine instead of their own medicine. I've even had people call because they took their dog's medicine, and that happens a lot. And so it's something that we get a lot of calls about, and we want to be there to help answer people's questions so that they then feel confident knowing what to expect as well as how to stay safe.
Well, thank you. A lot of people are taking medications, not older adults. Why are older adults more at risk of falling due to medications compared to other ages? What makes them
Yeah,
more at risk?
Yeah, definitely. So, one of the biggest reasons why older adults may be at more risk for falls is that as we age, our bodies go through a lot of different changes. We may have differences in our weight and how our body moves, our mobility, we call that. We may have different medical conditions that have accumulated over time that also require medications to manage and keep us healthy. So, older adults often tend to have multiple medications that they take. We call that polypharmacy, which is a fancy way of saying many, many medications. We may have decreased mobility and reaction times. So if you do find yourself dizzy or losing your balance, that recovery time can be, and the strength to recover can also be affected by those medications as well as the underlying conditions those medications are due to treat.
What are some common medications, types of medications that are known to contribute to falls?
Yes, there are several families of medications that can cause falls. So, a list of all the medications that could be contributing would fill a book. But in general, the main families include um, medications that we would call sedatives. Sedative means something that might make you sleepy. Sleep medicines make perfect sense to fall in these categories, but also pain medications can fall in this category, as well as some medications that you might not think would make you be sedating or make you sleepy. So, over the counter medications such as cough medicine or allergy medicine also can contribute to making you sleepy and thereby lose your balance or have trouble walking. Or if you do stumble, make it less likely that you'll recover as easily as you would if you weren't sleepy. There's also medications that are used for your heart and blood vessels. Um, Things that affect your blood pressure can make you dizzy. And so, if there is a medication error with a blood pressure medicine, it might make you more dizzy, especially when you're sitting down and then you stand up. Suddenly, you get that woozy feeling. And that can also give you a moment where you lose your balance and fall. Diabetes medicines can affect you as well. If your blood sugar gets too low, oftentimes it can feel a lot like being dizzy, like it is when your blood pressure is too low. It can also cause some confusion, that feeling like you just can't think straight or think fast enough. And that can also affect how you're able to move as well as recover from a fall. Pain medications, I think I mentioned before, they're also very sedating. And then there's a whole big category of mental health medications. And these can include medications that are used for depression, they're used for anxiety, they're used to help you focus, they're used to help kind of sort through voices or things that you might see um, that need help and management with medications. A lot of those medications, part of their side effects have to do with making you sleepy, changing how fast you think or how well you think. And so it's important to be, um, it's important to know which medications you're taking um, and how they might affect you and affect your reaction times. These are just some of the families of medications that could possibly cause a problem. But it's also just very important to know, um, all the medications that you're taking and how they might affect you and your balance and your thinking.
Awesome. Uh, Sorry, lost me for a second there. I'm back. You mentioned medication errors just a few minutes ago. Could you expand and tell us what exactly are medication errors and how can they put them older adults at risk of falling?
Sure, medication errors can be quite varied. There's a lot of different kinds. But in a nutshell, it's anytime you take a medication differently than how your doctor has intended you to take it. It could include taking too much of a medication. It could be taking the wrong medication. It could be taking the medication the wrong way. It could be taking medication doses too close together. It could be taking medications more than one that have the same ingredient in the medication. And so there's a lot of different variations on what could be causing a medication error that could affect somebody, which is why at the Poison Center, we always encourage people if there is any confusion or doubt to give us a call and we can help sort out whether or not what happened is a problem. And then, if it is, how big of a problem, and then what to do about it. An example I had recently of just such a medication error happened when a gentleman, he's 74, and he called me up and he said, I think I did something wrong. I'm feeling drunk. Those were his words. And he said, I'm feeling woozy and I can't think straight. And I realized what happened is I took my wife's medicine instead of my medicine. So we started having a conversation around what medicines he took that were not his medicine, as well as the medicine he was supposed to take but didn't. And there was a lot of medicines on both of their lists. And when it came down to it, his wife was taking medicines for blood pressure and for Parkinson's, one of which is a pretty strong sedative. And so I was able to tell him, you know what? I'm not surprised you're feeling the way you're feeling. That makes perfect sense considering what happened. The good news is that this isn't going to put you in the hospital or anything terrible like that. The bad news is you're going to be feeling woozy for a while. And while you're feeling woozy, we need to come up with a plan to keep you safe. And so the first thing was I made sure he was at home. He was. He was not alone. His wife was there. And so we just made a plan as to what would work for him in terms of keeping him safe so that woozy, stumbly feeling, as long as he was still feeling that, he didn't trip or lose his balance or in some other way fall. And he did great. The medicine wore off and he got back to normal and all was well. And it was a perfect example of why and how we can help folks in these situations.
It sounds like there's multiple factors that can lead to falls when it comes to medication. What are some recommendations that you have for older adults to decrease their fall risk with medications?
Sure. Number one, and most importantly, is know your medications. One way to do that that we recommend is called a medication review. A medication review is where you get all of your medications together and with the help of a pharmacist or your doctor if you need be, but the pharmacist is easily the most accessible person to get a hold of to kind of go through and make sure that everything makes sense. There are resources that the Washington Poison Center has online where you can print them out, things like a medication list that give you materials where you can write down what is the name of the medicine, what does it look like, how strong is it, and why are you taking it. A lot of people take their medicines the way they're supposed to, but may or may not know exactly why they're taking it. A medication review takes that whole list of medicines and kind of goes through it and just checking in. Do I really need this medication? Do I really need to be on this dose? I have one doctor give me this medicine, but another doctor gave me another medicine, but they seem a lot alike. Do I need to be on both? Those are the kinds of questions that a medication review can answer. And it's very helpful to kind of get an idea of, is in my personal picture, in my personal story of all of my medications, is there anything here that we can adjust to make it safer and less risky? One important thing about that too is a lot of times people will think, oh, it just counts for my prescription medicines. But it's more than that. It counts for your any medications that you might take over the counter. And over the counter means the kind of medicines that you can buy in a grocery store or a drugstore, things like allergy medicine and medicines for your gut. Those are all important medicines to include. It also includes supplements, vitamins, things that you might not even get at a drugstore, but you get at a supplement store to help with your body, your eyesight, or your how you think. There's a lot of things out there that people take and that feel that help them. And also in these days, you've got to be careful too about other things like cannabis products or alcohol or products with alcohol in them, since both cannabis and alcohol use can contribute to that lack of balance, the slowed thinking, all of the things that other medications can also lead to that increase in fall risks, as well as a lot of them can interact with the medications that you take. And there are a lot of medicines that flat out will say, don't take with alcohol, and the same would go for cannabis as well.
That sounds like some sound advice. Just briefly, you said supplements too. Can supplements have interactions with your regular medication? Or what are some common ones? Do you know of?
For sure, yeah. So one of the most common supplements that we get called about is melatonin. People use it for sleep. It's not a sedative exactly, meaning it doesn't turn your brain off, if you will, but it does turn your sleep cycle on. So when you take melatonin and you're taking other medications, it's almost like taking the medicines while your brain is in sleep mode. And so that can affect you a lot. There's other supplements and vitamins that, for example, like grapefruit supplements, people like to take that. And grapefruit can change how fast your body metabolizes or processes certain medications. So it can make some medicines less effective or other medications more, too effective if you're taking that. So those are a couple of examples. Again, all of the examples could fill a book, but that's what the Poison Center is here for. We're your book, your personal pharmacist you can call and ask, hey, I looked it up. I hear this a lot too. I looked it up on Google and I can't get a straight answer. We'll give you the straight answer and we'll get the information from you. Sometimes that can take a little time, especially if you're on a lot of medications, but we'll be able to take that time. We're here for you to sort those types of things out. It's also a good idea to call the Poison Center if you're thinking about taking a medication or a supplement. I get calls like that too. People will say, I'm looking to take this muscle builder. Is that something that's safe for me to take with my other medications? And we can help guide you to make that safest decision.
Awesome. That's a lot of good advice. And I never knew that grapefruit could really increase the effects from their medication. So older adults have completed their medication review from the provider. What should they do next? What else can they do to decrease the risk of falling?
Yeah, one thing I would recommend, you've got your review, you have it all written down in a nice notebook, is share that with your family or other people who take care of you. So if ever there's a question, they're able to easily answer the questions if a healthcare provider needs to have that answered in order to help. Um, there are a lot of things you can use to help making taking your medicines easier. It's very important to take your medicines the way they're made to be taken. And so things like a pill minder, a MediSet, that's where you have Monday, Tuesday, Wednesday, morning, noon, and night. Um, Setting up your set once a week with the help of a family member who can double check your work also helps not only tell you when is the next time to take your medicine, but it can also answer the question of, well, did I take my medicine? I get that question a lot too. I can't remember if I took my medicine. So I took it again, and now I don't know if I'm good or if I took a double dose. And so we get a lot of questions like that. Having a MediSet can help you to answer those questions. Um, calling for med errors to the Poison Center is also really helpful. Keep our number handy in an easy to find location. Talk with your doctor about stopping medications that might not be necessary. Sometimes we take medicine for a short period of time and then we forget that maybe we don't need to have that anymore. Maybe our sleep is better and we might not need that sleep medicine. Things like that might help. Or maybe there's a medicine that can help us that doesn't have as much of an effect as causing sleepiness or balance changes. So those are things to talk with your doctor about. and not ever do that on our own just because. You want to make sure your doctor is aware of it and that you can do that safely. Talking to them about switching to safer alternatives, keeping doses as low as necessary is also really helpful. There's also phone apps or, things, calendars that you can put up on your fridge that also help remind you of when to take your medication. Sometimes people have to take medicines, 3 or even 4 times a day. And having a little app on your phone that gives you a little jingle whenever it's time to take your medicine can help you to take your medicines on time. Timing can be really important when you're taking medications, and making sure they don't build up or they don't get too low in your body as well. We also recommend never keeping old medications. It's hard not to, because sometimes when you've had a medicine that was important, you think, oh, I'm just going to keep it around just in case. But a lot of times that's just a recipe for another medication error, because people will grab the wrong bottle. They'll take an old medicine or they'll take somebody else's medicine. If you have more than one person in your house, and this goes for pets too, that are on medications, using color coding, like those color dots that you had in school, and choose a color for each family member and put that color dot on the top of the lid. And that way, for sure, all my dots are blue, and I'm going to make sure that I don't end up taking my dog's yellow dot as well. Those are all helpful things to make it simple, because accidents happen. We know this, and people do make mistakes, and we're here to help make it as easy as possible.
Awesome. I wanted to direct the audience to some additional information too. You can go to our Washington Poison Center website. We have a whole bunch of downloadable management resources posted on there that you can download. I think we might have a link for that. Maybe not. Okay. It's posted in the comment section. So if you go in the comment section, you can go there. You can Washington Poison Center's website, and you can have download a whole bunch of printable resources to help you manage your medication. With that, I'd like to thank Amanda for coming to speak on medication management today. I learned a lot of new stuff, definitely some great tips. And thank you for everybody attending, if you're watching this now live or if you watch it in the future on the recording. Have a great day.
Thank you.